I want to start with some basic definitions. So trauma, by definition, at cancer.gov, is the injury to a body or an event that causes long-lasting mental or emotional damage. Polytrauma, by definition, as it defines by Department of Veteran Affairs, is two or more injuries to physical regions or organ systems, one of which may be life-threatening, resulting in physical, cognitive, psychological, or psychological impairments and functional disabilities. And radiation fibrosis, by definition, at cancer.gov, is the formation of scar tissues as the result of radiation. Like a picture reference for what fascia adhesions look like. So, in nutshells, is the stickiness in two or more layers of soft tissue. So just to give a background to our audience, some of us are clinicians here listening and some are non-clinicians. So what is a fascia? So fascia, I find it very, very interesting. It's a soft tissue casing. The best way to describe it is the casing we have in every single cell part of our body, whether it's vital organs, whether it's layers of muscles, joints, or blood vessels like arteries and veins, whether we have the lymphatic vessels or even the nerves. So everything has a casing. So when somebody is going through treatment which involves surgery, so they're cutting, there's a surgery there, and we know that the healing happens or the scarring happens from inside out. Or they're going through radiation where there's a micro trauma, the skin breakdown, or there's tissue underneath has breakdown, there are wounds around it. So as they heal, and the nature of the scar is when it heals, it shrinks. That's the nature of how the scar healing is. And so when it's healing, the scar is healing, the tissues is shrinking. Same thing is happening with the radiation affected part. When the skin is healing, when the tissues are healing on the affected parts, they tend to shrink, they can tend to get stickiness in it. And the layers inside the fluid, which is moving inside the layers of the fascia, they tend to become a little sticky and they form what we call as fascia adhesions. Now, so we're talking about the assessment. So when I have a patient who's referred to me for breast cancer rehab or lymphedema, so I've created a guideline for myself, just a template. Not everything is in there, but at least I try to do a bullet points of what I like to look into that during that assessment. So of course, I'm looking at lymphedema. I'm looking at lymphedema of the arm, of the chest, neck, wherever I feel that would be affected. I'm looking at axillary web syndromes, and I'm looking at cordings. I'm looking at cordings not only in the armpit, which is the axillary web syndrome, but I'm also looking at the surgical cording. If they had reconstructions, maybe cording there, or any part which was affected by radiation. And I find that the cording is, mostly in the radiated sites, I find cording a lot. This is interesting. So it almost looked like my neuro practice and my ortho hand practice had crossed over into the oncology world, where we give the visual facilitation to our patients. But I find it very, very helpful, especially with my quote unquote guarded patients. And when I want to educate them about their deficits, I want to posture and how they're doing the exercises to use the mirror. It also, it facilitates the neurons in our brain, and it also helps to build more pathways between the two hemispheres, the right and left hemisphere. So sometimes I'll even start with like left and right laterality training with my patients using the mirror. So sometimes I'm teaching my patient how to do laughter yoga. I put a link here at the bottom, but then also, Dr. Kataria's the videos are easily available on YouTube if you go to his channel. So I teach my patients to do that. I'll just show them, I do a demo that, close your eyes, breathe in, and then you ha 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 ha. And it's funny, it's within seconds, I think the stress just melts away. It helps to, just break that ice with those patients who are very, very guarded. But I also, cut a joke on myself. Listen, when I started this practice at home, I did not alert my family that I'll be doing this ha 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 in the morning by myself. So, just make sure you alert it so they don't think that, Not that anything wrong with that, but it's good to give fair warning to family members what you're up to.